So over the period, people who know me have come to a realization that all the time I'm trying to find out some bit of information about autism, the mothers who have kids with the autistic spectrum and all that. But I just want to say one thing. If you're a mother and then you've by chance hit on my channel, just pause. I want to tell you that you are doing a great job. It's not easy. I've seen quite a number of people, and I mean, this video is going to be on YouTube for a very long time, so I don't want to put anybody's name there. But hey, you people are the best thing that has ever happened to our generation. Yes, and I mean it, because it's so difficult to live with someone who doesn't understand you, who has a different perception about life, different ways of thinking, different ways of behaving, and all that, and you still find ways and means to live with them. I'm not sidelining the men. Yes, I'm talking about parents in general. But so far, ones I've seen are mostly mothers. So today, my topic is going to be on autism, and I'm going to talk to you a little bit about, how to notice it and how to actually deal with a child who has autism. I'm always Dr. Samuel Ologo. I'm a board certified doctor from Ghana. So let's get a little bit into it. Yeah, you can see that I'm in a different location. Yes. I'm in a different location. I'm shooting from somewhere else, but all the same, I just thought it wise to still bring you the best of content. If you've not subscribed to my channel, just take a second. It doesn't hurt. It doesn't take anything from you. Just hit on the subscribe button. And if you like this content, kindly like it, comment. If you have any question, just drop it down there. You can also share it to someone who doesn't have it, and then let's see how we can create a very big community. I try to bring you the best of knowledge in everything here. Okay, so let's go a little bit into it. What is autism? What is autism? So actually, people we don't even term it just as autism. We term it as a spectrum, okay, as a spectrum, and we don't say it's a disease. It's actually a condition. It's a neurodevelopmental condition, okay, that tells how people communicate, they interact with others, how they, their character. Okay, I don't go deeper into the terms and all those things. I'm just trying to let you understand what it is, and then we move on. Yeah, so it's characterized with repetitive acts. Okay, the children tend to do things that like if you are looking at me, they tend to stare at particular things for a very long time. They gaze, all right? They tend to behave in a particular way that you might not even understand. So what are some of the causes? We have the genetic causes and then the environmental causes. Come with me. So for the genetic causes, one thing you need to know is that the main cause of autism is unknown. All right, the main cause, the actual thing that is causing autism is unknown. Then we move on. We said genetics. Yes, so for genetics, it's not really that there is a gene in you that is leading to the cause of autism, but because it's related to the brain, researchers and scientists were able to say that, okay, let's see, we found out that there is Rett syndrome, there is Fragile X, and most of these things are related to the brain. And so it turned out they were able to relate some of these genes to autism, depending on how the child is actually reacting or interacting with society. All right, and then we move on to the environmental. With the environmental factors, we do talk about pregnancy, viral infections during pregnancy, certain toxins, okay, like lead poisoning, infections during pregnancy, especially when you are pregnant, and then you tend to be taking certain medications, certain let's say illicit drugs, okay, and then things that actually lead to low amount of blood supply to the brain, okay, low amount of blood supply to the brain. Whose brain? The baby's brain. And then it leads to some of these defects. And so genetics and then environmental factors came out top, but the actual cause is unknown. So people are out there, they are like, what, they don't have the genetic, they've realized that they don't have the genetic contribution, the environmental, they've kept themselves too perfect and all that, but still they tend to find, yes, because the actual cause is unknown. These are things that were just related to the autistic spectrum. All right, going further, we talk about some of the risk factors. If you're, especially if you're a lady, if you're a man and then you have infection and then you carry it into sex and then there is a child, bear in mind some of these microorganisms tend to alter with some of the chromosomes. So make sure you are treated before, thinking of pregnancy. All right, now some of the risk factors we have, most often is the male child. So research proved that when you take 4 boys, you have 1 girl getting it, which means that it is more in males than in female. There's also family history. If you are from a family whereby one person had the autism, then it means in future. So please listen to my comment well before you misunderstand me. It means that this person or this family has the risk of reproducing or getting a child with autism. So it means you have to be very careful during that period of time. And we have other disorders such as the Fragile X. I mentioned earlier on in genetics, we have the Rett syndrome that was also mentioned earlier. We also have extreme preterm. Now with preterm, this is the trick. Any child born, like, if I say extreme, it means that less than 26 weeks, okay, if you are pregnant and then you have to deliver your baby from 26 weeks, you should know that this child is at risk of a lot of things. The point is, that is the time the brain, it's not that's the time the brain is forming, but there are nerves that needs to develop. Okay, so during these processes, during these times, the baby, that's why we keep them in incubator. Okay, not just the temperature, but there has to be that kind of silence and create that atmosphere or that environment in the womb, outside the womb, so that the baby can be able to develop. Now, if the baby doesn't get all these things, they tend to not develop well. So extreme preterm is one of the factors. Now, what are some of the early signs? What are some of the things you are going to see in a child that you need to immediately go to the hospital, see a pediatrician, and then get the child diagnosed of whatever there is? Now, social skills. Look, you tend to find children playing here and there and stuff like that, relating. Babies, they tend to pick things, they put it in their mouth, they tend to play, their gestures are so lovely. All right, now if you see that there is a reduced or absent social interaction between your child, your baby, and other kids at home. In Africa, people live in this compound houses where there's not just one tenant, where the child is stuck to just the mother and father. No, it's that there's a different tenant who also has babies, another one. So if this child is shunning away, and if you are in the diaspora as well, you see that your child is not playing well with kids in school and stuff like that, you should know that there is something socially off about this child. So you need to go see your pediatrician. Then we move on to what next? The delayed language. Now, there are children who are unable to speak by age of 2. And when that happens, it's not speak as in they have to make a whole sentence. No, but the mama comes out, dada or papa, or the 2-letter words, the 4 combined, and all these things from 2 years, 3 years. If this child is unable to do any of these things, you should know that there is something that might actually be going on with this child, and you need to immediately attend your GP practice to get a referral to see a pediatrician. Also, there is difficulty with social interaction or social reciprocity. Now, social reciprocity is, let's say, even at home, if as a mom or a dad, let's say you take a candy. I think I have a candy here. That's why I'm going to use a candy as an example. Let's say you take a candy, and then this candy, you give it to the child. All right. You expect that the child will also give it back to you, so that playful scene will be, appreciated. Now, this child takes, you hand it over, the child can just be staring at you and then not do anything, just be staring at you. When this happens, you should know that there is something wrong with the social interaction of this child. The child is not reciprocating. So like, you take it, you give it back, and that kind of playful scene keep on going. Now, there is impaired initiation of skills. This child always wants to stay at one place without doing anything. They will just either be gazing at an object in one direction or nothing at all. Okay, when you see some of these things, please, you need to act fast, because it's not just normal. Children, they fidget, they try to pick things, they put it in their mouth, they try to do a whole lot of things. So if you are not seeing this in your child, then it means that you should get some form of attention. Now, they are not responding to sound, not responding to voices, nothing. Like, the child is playing, and then you're like, which name? Just suggest a name. So put a name down there in the comment section, and then just be like, stop that. Okay. And then the child doesn't stop. The child doesn't listen. The child doesn't even hear the name that you've just typed in the comment section. Yes. So the child doesn't. It means that there is something wrong. It's not just with hearing, but there may be other things that you need to pay attention to. There is repetitive behaviors. Now, these behaviors are things that they just take this, they look at it, and then they put it down. Then they take it. And this is all what they are doing. This is all what they are doing. This is all what they are doing throughout their day. This is what they are doing. It's not like the whole day, but throughout the day. Also, sensory sensitivities. If you realize that your child unusually reacts to sensory stimuli, oh, you need to pay attention. Difficult with transition. Like, there is one specific sound. If the child hears it, or every night they want you to turn the light on, every night, and there is no changes to that kind of sensory, you need to pay critical attention to these things. Now, going forward, let me see what I have. There are other signs like regression in skills. I mean, they used to talk, but from age 3, you tend to realize this child is not talking anymore. This child is not playing with people anymore. This child is not following instructions anymore. This child is not doing, or tends to be doing, a specific hand movement all the time. You should know that there might be something going on wrong with your child. Before I move on to the next thing, I want you to just take a second, kindly subscribe to the channel, and let's hit at least 1,000 subscribers. All right, let's move on. Yeah, moving on. So just before we go into how to even manage some of these things, back in the days, people came out with the perception that there was a vaccine that was related to autism. And so people actually stopped vaccinating their children, giving them vaccines for certain, let's say influenza, BCG vaccine, rubella, polio. People actually stopped. And the reason was because they felt the measles, mumps, and rubella vaccine was actually causing children to get autism. But hey, I'm here to tell you that that is not true. Okay, it happened, I think, in the UK, and they did a lot of research into it, and they realized that most of these vaccines, if a child is 2 years and they are now coming, they get to their hospital to get vaccinated for the standard development goals, the vaccination schedule for children, for babies. Okay, most of these autism spectrum disorders were diagnosed when the children are 2, and at 2 most of them are going for the MMR vaccine. So it turned out that, so it was just after the vaccination, that's why my child got this. No, that's not it. That's not it. It's just that they coincided at the same time. Okay, and most of the autistic spectrums weren't diagnosed earlier. Okay, like for me, back from where I come from, most people thought it was something related to spirituality and other things, and so they actually prevented the kids from getting the actual care that they needed, and that became a very big problem. The children didn't grow in their full capacity and all that. But we are in the 21st century and things are moving differently. So if you find this video, send it to someone who might be going through this challenge, and then let's see how best is going to help the person. Now, let's go to how we are going to manage someone with autism, because it's not easy. As I said from the beginning of my video, just say kudos to any woman out there, any father out there who is taking care of a child with autism. I'll be bringing you a video with me and someone, a parent who has an autistic child, and then we see how best we can delve into it. Now, let's see. Treating or managing autism is a multidisciplinary measure. It's not just one department that treats autism. Your pediatrician cannot treat autism alone, because there's a lot of training that goes into it. I have people who have trained their children so much better than even normal people. Yes, I am bold to say that, because these people, I've seen autistic children who are cooking, who are polishing their shoes, lacing their shoes, doing a lot of fantastic job out there. And I'm not shy to say that, yes, they are doing a lot of good works. Kudos to all those parents. So going on, it's a multidisciplinary treatment. Now, we need a speech therapist. If the child is unable to speak, you need a speech therapist to at least get the child to say one word or so. Okay, it's very difficult, but through therapy, they are able to say words like mom, ma, da, and they are able to understand when you even do your lips as sign language to them. They are able to pick those things up. They are specialized things, but we won't go there now. We are just doing the surface of autism. There's also physiotherapy. There are others who do not want to even move from one point to the other. So you get an occupational therapist. They do bang their heads on walls, on tables, on things a lot. And so when you get an occupational therapist, they are able to get them their specialized chairs, okay, where they can sit in. You strap them, and then even during feeding, you are able to help them. There are some children who they are unable to eat certain types of meals, so they will just be picky about everything. They can put their fingers in the food for several times and then they will just discard it. You need a nutritionist to help you walk through some of the journey, so that they can tell you at least the texture of the food, the color of the food. There are a lot of communications that go on with autism, so you need to work on that. Now, there are educational interventions. The child gets to the point where they need to go to school. You don't just carry the child into any form of school like that. They need to move from one point. Some of them are very good with technology, music, and other things. I know some. That's why I'm actually saying this. So you need to know your child from the point go, and then be able to tell which one or which school, which special school will this child be able to, play a major role in. Now, if you're at home and the child is not socially connected, the onus lies on the family around. That is why I said it's a multidisciplinary. You need the family also around to make the child feel at home and be able to communicate between the siblings. If it's not just one child, it means they can be able to communicate among themselves, and then there are things that they will learn from the view, from seeing, from hearing, even though they are unable to be vocal and all that. There are things that they will turn up to learn from these parents, from children. And also there are certain medications that they give, okay, to sometimes just help them to calm down, sometimes help them manage certain specific symptoms, okay, because they tend to eat things that you might not like. Sometimes you see them even chewing their hair. Okay, so sometimes you need to clear the gut. Sometimes you need to clear their brain so that they can even sleep and all that. All these things come as complementary therapies, but it depends on the parent and what the child is actually going through, because every autistic child is special and is different from the other counterpart. Now, when you go to the hospital, there are things that we do. But look, let me come here and tell you that recently I interviewed a mom who told me that, yeah, there is stem cell treatment going on out there. Yes, I've heard about them. I've read quite a number of them as well, but it's not definite, okay? It's not definite. When it comes to the stem cell, she wanted us to talk. I'm going to interview her, so we will talk and then tell me how the progression has been, and if it's good, we will tell people if they can go into it as well. Don't keep this video alone. Spend some time, give me a shout out, put a comment down there, tell me something. I'll mention your name in my videos and give you a shout out. So it's always Dr. Samuel Ologo on A Robust Lifestyle with me. Thank you and cheers.